Hello. Today we're talking about the issue of infection prevention in the community during the Covid-19 crisis. Our guest today is Clare Johnstone, Head of Infection Prevention and Medical Devices at Central London Community Healthcare NHS Trust. Welcome, Clare, and thank you to Medipal for providing the educational grant that made this video possible.
Thank you for having me.
What are the biggest challenges facing community nurses during the coronavirus pandemic?
Gosh, the biggest challenges, where do I start? So I think practicality-wise, working outside of a defined healthcare setting in the home or in social care settings creates huge challenges when all of a sudden you're expected to wear a very different PPE from what you would normally wear. So accessing PPE, carrying it around with you, access to hand hygiene facilities and waste disposal have been significant challenges for the community teams, all of which they've adapted to fantastically. I think the other side of the coin is around the scale of change that has happened. So we've found that as a community organisation, we've been obviously stepping up to support the acute hospitals, acute organisations, GP practices and social care. So we are being asked to contribute and support in so many different directions, and it's about making sure that we're able to allocate resources safely and effectively to support as much as possible. I think the adopting new technology has also been a challenge, but one that our organisation has certainly embraced in terms of developing systems and processes for virtual consultations, reducing the need for staff to be face-to-face with patients. So yeah, lots of different challenges, practical, technological and strategic.
Great, thank you. So many challenges, but it sounds like many solutions as well.
Yes.
And obviously the community being, staff in the community being, as we know, almost like the glue between all the other different sectors.
Absolutely, that's a great way to describe it.
In practical terms, what steps should community nurses take before visiting a patient for the first time to ensure the safety of their patient?
So it's really important that they try and get as much information about the patient as possible, as they would do in any normal circumstance out with of the COVID pandemic. However, in this situation, it's even more essential to make sure that they're able to use the appropriate PPE and take the appropriate steps to maintain their safety and the patient's safety. So we're asking our community teams to contact the patient by phone if at all possible prior to the visit, to make a risk assessment of the possibility of COVID, both for the patient that they're seeing and also for anyone else who's in the household. Are there any possible or confirmed cases within the household? Is there anyone who is shielding and is vulnerable, so that we can make an assessment and make a plan for the most appropriate way to see the patient, and also whether that be a virtual consultation, delaying the consultation until maybe a little bit further down the line of the illness, if a patient does have COVID or someone in the household does have COVID, or allocating them appropriately on the list for that day to make sure we're maintaining the safety of not only the staff but also all the patients on the list. They need to make sure that they're applying standard precautions as they would in every clinical situation, and also transmission-based precautions, and ensure that they have appropriate PPE if they are doing a face-to-face consultation for the intervention that they're doing.
So you touched on personal protective equipment there, PPE. So what sort of PPE should nurses use when visiting a patient at home?
So it really does depend on the intervention, the procedure that they're doing and the setting. We are following the National Public Health England guidance around PPE for Covid-19. So we have two distinct categories. We have the apron, gloves, face mask and eye protection for contact within 2 metres of any patient, so that's a patient who has been assessed as being at risk or a known confirmed COVID patient, or contact with any patient, whether they have symptoms or not. And then if they are doing an aerosol generating procedure, which some of our community teams do in the home setting, they would need to be using an FFP3 respirator, a gown, gloves and eye protection. It's really, really important though, as well as using the PPE, that staff are carrying out hand hygiene. That's absolutely essential before donning the PPE, before the procedure, after removing it once they've completed the procedure, and that they're able to dispose of the PPE appropriately as per the national guidance. We also need to make sure that given that some home settings don't have great hand hygiene facilities, either they're not accessible to our clinicians or they are not in the best condition, that they have alcohol hand rub available as well to make sure that they can clean their hands effectively.
Great, thank you. Really useful practical advice there. Sticking with the subject of PPE, obviously we know there's been shortages or certainly concerns raised about shortages in supply. What's your advice for nurses if they consider that the PPE they have is inadequate?
Well, it's really important that all organisations provide adequate PPE for their clinicians. But the first thing I would say is that the community teams, the healthcare workers need to understand what PPE is required for the intervention that they're doing, in the setting that they're in, and why. However, if they are concerned about inadequate PPE, it needs to be escalated, of course, to their line manager, service manager, to the infection prevention team, so that we can work out collaboratively a solution, and we can make sure that we've risk assessed and we are putting the safety of our clinicians at the forefront. We've had some really constructive discussions with our staff around the PPE that they're using and how it is supplied to them and how they are able to, carry it round with them. We've also had some really constructive discussions with our staff side reps, with our union representatives as well, around PPE concerns. So I would say that it's a really open and collaborative dialogue within our organisation.
Great, so communication key, basically.
Yeah, absolutely.
So how should a nurse respond if they think their patient or a relative of that patient who they're visiting has got symptoms of coronavirus?
So they need to make a risk assessment. Obviously, there's the PHE guidance around initial assessment and investigation of COVID-19, suspected COVID-19 patients based on clinical criteria. And that would be making an assessment based on clinical symptoms, the new onset cough, a high temperature over 37.8, and additionally, most recently, the loss of taste and smell. There are other symptoms that can present, influenza-like illness symptoms, and the nurse or the healthcare professional who is in the home needs to make that assessment. They can signpost the patient to the NHS 111 service, either via the telephone or online, for further assessment if they think they are clinically stable. They would escalate to their team or service lead to confirm the plan. They may well contact the GP for a virtual or a physical assessment if they felt that the patient was unwell enough for that, or they might need to also call 999 if they were very concerned and the patient was deteriorating.
Thank you. And now we're going to end with a big question. What lessons have we learnt so far from the pandemic, and what support do community nurses need to maintain both their own and their patients' safety?
Oh gosh, so many lessons at this point, and I'm sure more to be learned. I think the biggest thing that I've learned is around the resilience and the adaptability of the NHS, of our organisation, of the clinicians on the front line within the community organisation. their ability to adapt to running services in a very different way in a very short space of time using alternative technology. I think another specific infection prevention lesson is that whilst this may be a new novel virus, actually the infection prevention interventions that are recommended and used to break the chain of transmission are absolutely key, almost bread and butter infection prevention interventions. So hand hygiene, absolutely essential for stopping the transmission of infection, and the appropriate and effective use of PPE. So not only having the correct PPE to wear, but making sure that healthcare that clinicians are comfortable putting it on, taking it off, knowing the correct order in which they put it on, they take it off. And the fact that actually it's not just as simple sometimes as putting on a pair of gloves and an apron, that there is a process to think through, and actually practice makes perfect.
Some fantastic insight there. Thank you very much. We've come to the end of today's talk. Thank you once again to Clare Johnstone for her time and expertise, and to Medipal for their educational grant.